Hi, I am Dr. Abel George, CEO of Apollo Adlex Hospital in Ernakulam, Kerala, in India. In my presentation, I will be talking about something that lies at the heart of healthcare in India, the rural urban divide in maternal and child health. India, with a population of over 1.4 billion, is the most populous country in the world. Approximately 65% of Indians live in rural areas, while the rest in urban centers. And this demographic divide possesses challenges in ensuring equitable healthcare delivery across regions. The United Nations Sustainable Developmental Goal (SDG 3) aims to ensure healthy lives and promote well-being for all at all ages. Within this, targets such as 3.1 reducing maternal mortality, 3.2 ending preventable child deaths, 3.8 achieving universal health coverage directly relate to India's maternal and child health outcomes. Addressing the rural-urban divide is therefore crucial to meeting this global commitments. A rural-urban divide in maternal and child health. Maternal health, urban women benefit from higher rates of antenatal care and institutional deliveries with skilled attendants, which the rural women do not have. They face specialist shortages, under-resourced facilities, etc. Similarly, with child health, urban children have better access to immunization, neonatal care, and early intervention. In rural areas, neonatal and under 5 mortality rates are higher. So the gap is not only about infrastructure but also about timeliness, quality, and continuity of care. Nearly 65% of India's population live in rural areas where access to quality maternal and child health services are limited as compared to urban centers and cities. India's national maternal mortality rate dropped to 93 per 100,000 live births, but rural areas continue to report higher mortality due to delays in reaching emergency obstetric care and specialist shortages. Urban centers have stronger emergency obstetric neonatal care units, reducing maternal and perinatal deaths. Under 5 mortality rate nationally is 42 per thousand live births, but rural children face higher risks as compared to their urban counterparts with limited access to neonatal intensive care units and preventive services. About 89% of rural mothers deliver in institutions compared to 95% in urban areas, and the CHCs face a shortfall of almost 80% in terms of specialists, directly impacting safe delivery and newborn care. India has implemented several programs to strengthen maternal and child health. Some of the programs like Lakshya target labor room safety and respectful maternity care in high-load facilities. IPHS standards are set for minimum requirements for infrastructure, drugs, staffing. Then there are maternal and perinatal death surveillance reviews. Then there are some health interventions like the Janani Suraksha Yojana and Janani Shishu Suraksha Karikaram under the National Health Mission. A telemedicine platform like eSanjeevani extends access to specialist care in rural settings. The Ayushman Bharat Digital Mission enables longitudinal health records via the ABHA IDs. India aims to bring the maternal mortality rate below 70 per 100,000 live births by 2030, reduce the neonatal mortality rate to 12 and under 5 mortality rate to 23 per 1,000 live births. Some of the initiatives like Poshan Abhiyan and Anemia Mukt Bharat seeks to cut child stunting and reduce anemia among women by 3 percentage points annually. When we look at the maternal and child health in India, it is clear that the gaps between rural and urban care are big, but they also open up huge opportunities. So national programs, digital health programs, community health workers already provide a strong base, and the opportunity now is to strengthen the referral systems, use digital tools more effectively, build partnerships that focus on key issues such as anemia and nutrition. And by looking at the health system as a whole, small improvements can be made at different points of care. Now, for example, use maternal and newborn journeys to identify crucial delays, strengthen the referral pathways with reliable ambulance services, address underlying causes such as anemia, which is a prevalence of 57% among the women of age 15 to 49, malnutrition, adolescent pregnancies, forge public-private partnerships for diagnostics, skill labs, and neonatal intensive care, scale up accreditation under NQS and Lakshya for maternal and newborn care facilities. The rural-urban gap in maternal and child health is real, but it also means there's a lot of room to make things better. So if we strengthen rural households, make referrals smoother, and use digital tools like telemedicine more widely, mothers and children can get care much faster. Tackling issues like anemia, malnutrition, immunization, etc. can save countless lives. Rural mothers are still more likely to die from preventable causes, which raises a simple question: how do we make every delivery safe? Children in villages continue to face higher levels of malnutrition and incomplete immunization, so how do we close this gap? Moreover, digital tools that exist are not reaching the families who need them the most. So, some of the areas of focus are scale up safe birth and nutrition care bundles across CHCs, focusing on triages, emergency obstetric readiness, newborn resuscitation, institutionalized district health compacts with quarterly targets for ANC coverage, institutional deliveries, immunization, etc. Ensure 100% antenatal care and delivery data linked to ABA IDs. Build strong referral linkages which are supported by the ambulances, teleobstetrics, and tele-NICUs. Empower village health sanitization schemes. To conclude, this picture shows the story of every woman's journey. She begins as a child, to where the goal is to start well, that is to grow with proper nutrition, immunization, and care. But many don't make it. Many stumble because of malnutrition and preventable illnesses, holding the children back. As she goes to a young woman, the next step is to live well, to learn to work, to become a mother if she chooses. But here too, rural women face various difficulties as compared to urban women, like unsafe deliveries, poor access to emergency care, etc. And finally, every woman deserves to age well with dignity, freedom from chronic diseases, and access to health. So this is where Indian women stand today, and sadly, there is so much divide, and that is why bridging the rural-urban divide in healthcare is not just a policy discussion. It is about giving every woman the fair chance to start well, live well, and age well.